Hi, I'm Rachel. I'm going to be showing you how to do a blood transfusion. Okay, so first we want to take the chart and we're going to open the chart and we're going to look at the order. We have Jane Jones. She's admitted for a motor vehicle accident. Rule out ruptured spleen. Her birthday is 7/31/1955. Medical record number 14573. She has allergy to sulfa. Let's see, she's on bed rest, she's stable, nothing by mouth, vital signs every 2 hours. She has some dextrose, 0.45 normal saline going at 125 mils per hour. And then we have her labs here. It says she had a type and cross 1 unit of packed red blood cells. And then we have a lab for repeat CBCs at 0800. Call for results. It's now noon, so we're going to go ahead and call for those results. She has a Foley, and then she has a couple PRN meds. So that I'm going to make sure I have the patient's card. This is an accurate patient identification. Should be everything that's the same that's on the patient's bracelet. I'm going to make sure all this information matches. Same name, same spelling, same medical record number, same birth date, same doctor. And then I'm going to make sure all that matches, and it does. So with that, I am going to look and see what my cross match is and make sure everything matches my card once again, which it all matches. And then I look and I see she's AB negative. And then I'm going to look at the labs. She has, we're going to look at RBCs, hemoglobin, hematocrit. We're going to look at platelets. We're going to make sure that they're all within range, and if they're not, they're probably going to be low for this. And then we're going to compare it to the one they did before that, 3.5 hours earlier. We're going to look, they're all within range, so since the last time they did the lab, these labs have gone down. So with that, I know that I probably need to call my doctor. So before I call the doctor, I'm going to make sure.
What labs?
I'm in hemoglobin, red blood cells, hematocrit, and platelets. And then before I call the doctor, I'm going to want to take vitals, so I know what I'm talking about when I call the doctor, and I'm going to want to know how much solution I've given my patient since the last lab, because it can dilute it. Okay, so we're going to go in the patient's room. Patient's card. I'm going to wash my hands. My hands. Provide your privacy. Okay, so hi, Mrs. Jones. I'm Rachel. I'm going to be your nurse today. I need to ask you, what's your, can you tell me your full name and birthday?
Rachel Jones, 10/6/64, or
and do you
55.
have any allergies? Okay.
Sulfa allergies.
Okay. I'm going to also probably just want to do an extra check, make sure the card matches the patient, so everything's correct. And it does. So I'm just going to go ahead and assess the her vitals. So I'm going to take all vitals, and then I'm going to write those down. So from the last time the vitals were taken, like her respirations will be going up probably, and her pulse is probably going to be going up. So I'm going to write, you know, her vitals, and then I'm going to assess her, the way she looks. Is she pale? I'm going to make sure that she still has her Foley. I'm going to make sure that she's talking to me, level of consciousness. We're going to make sure we assess all those things. So I have my vitals, so I'm ready to call the doctor. I'm going to wash my hands before I leave the room. I'm going to wash my, alright, and then I'm going to come over here and call the doctor. I'm going to tell the doctor that what I have, what my situation is. So I'm going to call the doctor. Hello, Dr. Green. This is Rachel Voss. I'm taking care of Jane Jones, birthday 7/31/1955. We have her in from a motor vehicle accident. We had some labs done on her. Her Hematocrit, hemoglobin, red blood cells, and platelets have all gone down. We've given her 450 mils of dextrose, 0.45 normal saline since the first time we did her labs. And here's her vital signs. Do you have any recommendations for me?
Hang 1 unit of packed red blood cells now.
Okay, so I'm going to, since it wasn't on the order, I just got an order to hang 1 unit of blood cells.
Packed red blood cells.
Okay. I'm going to make sure to verify that with the physician before I hang up. 1 unit packed red blood cells.
Now.
Now. Okay, by Dr. Green. This is a telephone order. I'm going to sign it. Okay, so I have my order. Alright, so before I go get my order, I'm going to get ready, do everything I need to do before I hang the blood. So what I'm going to do is I'm going to go to the pharmacy, wherever I need to go to get normal saline only, and I'm going to need to get my blood tubing, which is a Y-shaped tubing. So I'm over here. So I have my normal saline, and I have my packaging to make sure this isn't expired. This is good. There's no leaks or crystals in there or anything like that, and everything looks good. Wash my hands before I go in the room. Okay, I'm going to want to identify my patient again, just to make sure I still have the same patient. Can you tell me your name and date of birth? Jane James, 7/31/1955. Okay, and I also see that she has her allergies on here, so that's good. Alright, so what I'm going to do is I'm going to make sure all this is, like I said, it's not expired. I'm going to open the tubing and make sure that there's no problems with that. And then we're going to do 5 things before we go get the blood, which is we're going to establish our baseline vitals, and then we're going to start our IV. So we're going to start the saline, then we're going to make sure that we have our consent form signed, which is in the chart, so I'm going to need that. And we're going to make sure that that gets signed, and then we're going to do a patient teaching, so we're going to go ahead and tell Jane, we're going to give you some packed red blood cells. It looks like they think there might be some bleeding, so we're going to get your blood cells back up and so we can make you feel better. And then we need to, if you need to use the bathroom at all, you might be here for a while. If they didn't have a catheter, they'd probably want to go and use the bathroom, because they might be here for, it could take up to 4 hours to hang the blood. So then we're going to make sure this is all good. There's no holes. It looks great. Nothing's wrong with the tubing. So we're going to, this is all sterile, so I would have just took this off. It's all sterile. I'm going to wash my hands. Before I do gloves, medication. Okay, so I have gloves on. This is sterile, and this is sterile. And, okay. So I'm going to make sure that this is clamped down before I hang it. Alright, so next thing, just you have to prime our tubing. So we're going to, we're going to open the tubing. Okay. So I've primed the tubing and gonna make sure I fill the chamber to up above the filter, about like 3/4 of the way up. All right, so we have that, and we're going to, since the other solution is running, we're going to have to disconnect it, and I'm going to, all right, he knows what I need. Okay, so I have my alcohol, and I have it ready. I'm going to go ahead and disconnect this. I'm also going to be assessing the site. I'm going to make sure that the right catheter size is in there. For my blood, it needs to be either an 18 or a 20 gauge, preferably 18. We're going to clean the end of the J-loop for 20 seconds. We're assessing the site and making sure that it's not infiltrated, it's not red or warm, and that it's patent. Everything's, if the stuff, or if the solution was already draining, this is sterile. I've cleaned it. I'm going to hook it up. All right, so we're going to just open this. Oh, you know what? I forgot to prime this, but we can do that. Just open both of these. That's primed. Okay, then we're going to leave this as TKO to keep open at 1 drop per 15 seconds. Okay, so it's 1 drop per 15 seconds. Okay, so we have 1 drop per 15 seconds. We're going to keep that open. I'm going to wash my hands now that I took off my gloves. Washing my hands. And I leave the room. Now I need to go get the blood. So I'm going to, I'm going to go get the blood. So with that, I need to take the card in with me. Oh, and I do vitals. There you go, vitals. Okay. So I'm coming into the lab to get the blood. Okay, I need blood for patient Jane Jones. She's AB negative. So we have Jane Jones. The lab's given me some blood. I need RH, anything that'll go with RH negative or AB negative. So I could give A negative, B negative, or O negative, or AB negative. So anything as long as it's RH negative. So this I have the lab slip here, and I'm going to compare it with my card. I'm going to make sure same name, same date of birth, same MR number, same doctor, and same blood bank number. We're going to compare.
Time out.
We're going to want to make sure that the blood gets all the way to the patient. We're going to open both of these. And we can see pink going closer and closer. It's almost our patient. As soon as the blood gets to the patient, I'm going to set this at TKO for the first 5 minutes, which is about 1 drops per 15 seconds. And I'm going to write down my start time of what time I started the infusion. And I'm going to take vitals every 5 minutes, and then every first 15 minutes, and then first 15 minutes after that, and then once an hour until the blood is infused, per protocol for facility. And I set this according to how the patient tolerates it. I'm going to stay in the room for the first 15 minutes and assess my patient's vital signs. I'm assess my patient's how they're doing, what they look like. Are they pale? Are they getting sick? Are they getting hives? Are they feeling like they can't breathe? Are they having a reaction? And then just document. Wash my hands after I take off my gloves. And I wash my hands when I leave the room.